The goal of this video lecture is to review characteristics of bipolar disorders. We'll discuss characteristics of bipolar disorders and the diagnostic criteria for disorders included in this category of the DSM. In depressive disorders, we saw mood states that were low relative to a euthymic mood state. In contrast, bipolar disorders are characterized by disturbances in mood that are elevated relative to a neutral or euthymic mood state, along with related symptoms. These elevated mood states may include episodes of mania or hypomania. In our last video lecture, you learned that episodes of mania and hypomania are characterized by the same set of elevated mood symptoms. Both require the experience of a distinct period of abnormally and persistently elevated, expansive, or irritable mood, and abnormally and persistently increased activity or energy. Along with this elevated mood state, at least 3 other symptoms must be present, or 4 if the elevated mood state is irritable rather than expansive or euphoric. These additional symptoms could include inflated self-esteem or grandiosity, a decreased need for sleep, an individual being more talkative than usual or exhibiting pressured speech, racing thoughts or racing speech, distractibility, an increase in goal-directed activity, or excessive involvement in what the DSM calls activities with a high potential for painful consequences, such as unrestrained shopping or sexually promiscuous or risky behavior. One key difference between mania and hypomania is the duration of the mood episode. The minimum duration that symptoms need to be present for the diagnosis of a hypomanic episode is 4 days, and the minimum duration for a manic episode is at least 1 week, unless the individual symptoms are severe enough that they need to be hospitalized or they're experiencing symptoms of psychosis. In addition, mania is characterized by more severe symptoms and causes functional impairment, while hypomania is uncharacteristic for the individual, but is not causing problems in functioning. These distinctions will be important to remember as we discuss the different disorders that are included in this diagnostic category. The primary criteria for a diagnosis of bipolar I disorder is that the individual has experienced at least 1 episode of mania. So they've exhibited a period of elevated mood, they experience at least 3 additional associated symptoms, their symptoms last for at least a week unless they need to be hospitalized or experiencing symptoms of psychosis, and they experience marked functional impairment as a result of their symptoms. Anyone who has met criteria for a full manic episode can receive a diagnosis of bipolar I disorder. The individual may also experience other mood episodes, including episodes of hypomania or depression, but a diagnosis of bipolar I disorder does not require the presence of depressive symptoms or of any other kinds of mood episodes. In contrast, to meet criteria for a diagnosis of bipolar II disorder, the individual must have experienced episodes of both hypomania and major depression. So, to meet criteria for bipolar II disorder, an individual needs to have met criteria for an episode of hypomania and had a period of elevated mood with at least 3 additional symptoms where there was a marked change in their behavior, but they did not experience functional impairment, and they experienced these symptoms for at least 4 days. But they also need, at another point in time, to have met criteria for a full episode of major depression, and that would be the same criteria that we applied to give a diagnosis of a major depressive disorder. So if an individual has ever met criteria for a full episode of mania, they could not receive a diagnosis of bipolar II disorder. A more appropriate diagnosis would be bipolar I disorder. If an individual has experienced episodes of hypomania, they also need to have experienced an episode of major depression in order to receive a diagnosis of bipolar II disorder. So if we had a hypothetical individual who had only experienced an episode of hypomania without any other mood episodes, they would not meet criteria for a diagnosis of bipolar disorder I or II. They would not meet criteria for bipolar I disorder because their elevated mood symptoms would not be severe enough to have been classified as a manic episode. And they also wouldn't meet criteria for bipolar II disorder because they would not have had the required major depressive episode. It would be unusual for someone to present for treatment if their only mood problems were episodes of hypomania, but in this case, the individual could receive a diagnosis of an other specified bipolar disorder. Our final bipolar disorder is cyclothymic disorder, or cyclothymia. In a previous video lecture, you learned that one depressive disorder, persistent depressive disorder, or dysthymia, was characterized by low-grade, persistent depressive symptoms lasting at least 2 years. Similarly, cyclothymic disorder is characterized by low-grade, persistent symptoms of both depression and hypomania. To receive a diagnosis of cyclothymic disorder, an individual needs to experience alternating periods of symptoms of hypomania that are not severe enough to meet diagnostic criteria for a hypomanic episode, as well as symptoms of depression that are not severe enough to meet criteria for a depressive episode, over a period of at least 2 years. Similar to what we saw with persistent depressive disorder, the symptoms must have been present for at least half of that time, and there cannot be a period of longer than 2 months in which the individual was not experiencing symptoms of either subthreshold depressive symptoms or subthreshold hypomanic symptoms. In comparison to the required duration of the mood episodes that characterize bipolar disorders 1 and 2, the duration of the symptoms for cyclothymic disorder is longer, but the severity of the symptoms is more mild. So that summarizes the major mood disorders included in the DSM-5. To differentiate among the disorders included in the categories of depressive and bipolar disorders, 2 important things to keep in mind are 1, that our classification of the mood disorders into depressive disorders and bipolar disorders is done on the basis of where their symptoms are relative to a euthymic mood state, and 2, the severity and duration of symptoms required for diagnosis when determining which specific within a category is the most appropriate. For bipolar I disorder, an individual is only required to have met criteria for 1 episode of mania. An episode of depression is not required, although many individuals with bipolar I disorder also have a history of hypomanic or major depressive episodes. In contrast, a person with bipolar II disorder needs to have a history of at least 1 episode of hypomania and at least 1 full episode of major depression. Finally, cyclothymic disorder is characterized by persistent, low-grade mood symptoms that are both elevated and depressed relative to a euthymic mood state, but that don't meet criteria for either a major depressive episode or an episode of hypomania over a period of at least 2 years.